Welcome to the Less Stressed Life podcast. This is your host, Krista Bigler, private practice integrative nutritionist, helping people across the U.S. reverse digestive issues, eczema, and autoimmunity via phone and video consult. To learn more, visit lessstressednutrition.com. Now, on to the show. If you're just joining us, in part one last week, Dr. Arthur Frankel, renowned oncologist, went into a deep dive on oncology or cancer therapies over the last several decades, as well as what immune checkpoint therapy is and what cancers it is used in. So if you want that deep dive in oncology, go ahead and go back to that episode. And in this episode, Dr. Frankel concludes by giving us some really interesting statistics about what might be the next big frontier in oncology therapy. Off to the show. So we're talking a lot about immune cells today, and actually I talk about this a lot. I may not talk about it with clients a lot, but this is what we're also manipulating often with anti-inflammatory food therapies and other things that are causing immune inflammation. How do you see things like food and diet and whatnot impacting the influence of this or influencing cancer care, if at all? And that might be a big topic for a different day also, but if you could give any input.
All right. So this is what I talked about in California. And this is now my research in area of love and interest. If you had asked me 40 or 50 years ago when I was studying the molecular changes in cancer cells, whether diet or the gut microbiome would have any impact on cancer or cancer therapy, I would have laughed at you and said, not in 100 years. But I was wrong. It turns out, and this is not my work, although I want to work on that in my new job, as I get a new location. It turns out that a brilliant scientist named Jennifer Wargo, W-A-R-G-O, she's also a superb surgeon at MD Anderson in Houston, her team discovered that if you have a high plant fiber diet, your response to immunotherapy is 5 times higher than people without a high plant fiber diet. That is remarkably different.
Yeah, it is. So how many people did she look at? And when did that come out?
This came out at a meeting at the American Association for Cancer Research in April 2019.
Oh, this is fresh.
It has not yet been fully, it's not yet been fully published as a paper, but Dr. Wargo has presented it as recently as a week and a half ago at a special National Institutes of Health mini meeting to review the gut microbiome, diet, and immunotherapy.
Her last name is spelled W-A-R-G-O?
Yeah.
Okay,
She
thanks.
has many publications, and anyone that would Google her would find a lot about her. I think she's just brilliant.
Cool.
Okay.
So 5 times improvement in immunotherapy checkpoint, right? That's what you said, 5 times improved outcomes, right? Okay.
Now, her group and other groups in France and elsewhere have shown 2 other things that hint towards the future. One is they've shown that people that are overweight, that are fat, are more likely to respond. Now, that's odd. Okay.
It's good news for most of people, though, right? For most of Americans, it's a good thing.
Yeah. For about 70% of Americans. Now that from the stress of what I've been going through, I'm down to normal weight, so it's not so good for me.
Mm-hmm.
The last thing she and others have found, and I have data as well, is that if you have antibiotics, if you take antibiotics, oral antibiotics or intravenous or a shot, before you get the immunotherapy for your cancer, your chance of responding is cut in half.
That's actually a really big deal. So thanks for bringing that up. I wanted to ask you specifically about that. That was her research as well that found that?
Yes, she has published that. a group in France has published that.
And
I
think that was in 2018 because I looked at your slides. Dr. Frankel keeps referring to California. I saw him speak at a microbiome conference in California a couple of weeks ago, and so that's what he's referring to. But I think your slide said 2018, so I'm going to repeat that. For people that took oral antibiotics prior to cancer immunotherapy, their likelihood of success decreased by half. Now, the success rate in general was 1/3, correct? So 30% roughly.
Correct.
So if they have antibiotics, your success rate is now 15% prior to therapy. How long before immunotherapy is this where it affects things? Because the microbiome can be affected by antibiotics for weeks or months. A month?
Many months.
Okay.
But most of these studies have looked at 30 to 60 days maximum before immunotherapy. So I would say you can't control, if someone gave you an antibiotic 2 or 3 months before.
Sure.
But at least if you know you have cancer and you may end up on immunotherapy, if you can avoid antibiotics, you want to. Now, not everybody can, because if you were on a chemotherapy and you got an infection, then you may need an antibiotic to stay alive. But the bottom line from this work and some of the work that I've done and the work of Dr. Wargo and others is that if you combine a Western diet with a lot of hamburgers along with oral antibiotics, your chance of responding to immunotherapy then could be 1/10 other people's. That's a big difference.
It's a huge difference.
And I was able to reproduce that in an animal model, and I showed that when I gave the talk in California. It was so frightening to me, and I didn't think reviewers at a public, at a journal would accept it, that I have not put it into my manuscript that I'm submitting at the end of this week because it's just too dramatic, and I was worried nobody would believe it.
Yeah.
But it's consistent with the work of Wargo and others.
Is this the time you had to feed 250 mice and you were worn out?
Yeah.
And what were you feeding them?
So I didn't know which diet would be good or bad for immunotherapy. So I had 5 different mouse diets. One was regular mouse chow, one was Western diet, one was a high-protein diet, one was a high-fiber diet, and another one was sort of halfway in between on the protein and the fiber. The high-fiber diet was able, and I don't want to imply to people that you can cure cancer with a high-fiber diet alone, but I couldn't get the tumor to grow in the mice with a high-fiber diet.
And why do we think that is? Why do we think that is? Because the fiber does what?
That gets to what my current passion is in my research. It turns out that the high fiber, this is cellulose and inulin, is not digested by your stomach or your small intestine. It gets all the way to the colon. Well, the colon, the only thing that goes on in the colon is the bacteria in your gut break down those fibers. And they don't break them down all the way to sugar because God or nature or evolution has made it that your colon has no oxygen, so that it can only break them down to short-chain fatty acids. Short-chain fatty acids are the same product of the probiotics and the prebiotics that seem to control inflammation and regulate the immune system.
Right.
So what's ironic is that the same bacteria in certain probiotics and the high fiber in the diet have the dual property of both reducing non-specific inflammation and improving proper T cell function. And that's just the way I explain it to people is that you're into alternative things. If you do yoga or you do meditation or something, it teaches you how to center yourself so that instead of all this, they call it chitti vrita, all these little vibrations that are hitting you all the time, your mind or your body can focus on real dangers and not on the garbage. And that is my impression, is that our immune system, and I published a paper on it, that our immune system can either just react non-specifically. Remember the shot in the arm, the inflammation is the initial reaction. You need that initial activation, but then you need that to calm down and the adaptive or T-cell immune system to take over and do its job. And by having the right diet and the right gut bacteria, it's sort of telling your immune system to be on alert, but on alert towards the proper immune system, not non-specific inflammation.
Okay.
And that's sort of our research now, is how is that possible? How could the gut bacteria, which are living in us, communicate in that detailed a fashion with our immune system? And the answer is, it's been doing it for millions of years.
It's so smart. That's why we call it the second brain, right? It's so smart.
Right. So there are, as I explained earlier in this podcast, the same signals that are reaching out to regulate the immune system are also communicating with the brain. Mm-hmm. So the bacteria that are in our gut, they want to stay alive. They don't really want you to drop dead, and they don't want you to get infected with one bacteria that kills you. So they have evolved even better than any of these cancers, because they've been doing it for billions of years. They have evolved with our multicellular organism called us. So that the shell, the human shell, which doesn't have all that much genetic information, can function to keep alive the bacteria in the gut. Many people, if they wanted to be cynical, would say the God in us or the brains in us is in the communicating bacteria in our gut, that complex of millions of interactions between the different genes, as much as in our mind or in our physical body.
Mm-hmm. So I'm going to recap that just a little bit. The work of Dr. Jennifer Wargo that has not yet published basically found that a high plant fiber diet gave a 5 times improvement in checkpoint immunotherapy, right? It was also found... Go ahead.
It has been published because it was published as a presentation at a national meeting. Mm-hmm. It's just not been... All the details are not yet available. Mm-hmm. So I can admire it, but I don't know the exact method she used to analyze the plant fibers in the diet or some of the other details, but her work has always been very reproducible, so I have every reason to believe that it is true. And of course, for some of the other discoveries that she and others have made with antibiotics before immunotherapy, that's been reconfirmed as recently as this week. Mm-hmm. There's an article in the Journal of American Medical Association Oncology that just came out confirming the effects of antibiotics. Then finally, that certain bacteria in the gut can help you respond or not respond to immunotherapy. You know, both is my work that was published in 2017 and then subsequent work in 2018. And of course, more people are finding that as we talk.
So I want to talk about these short-chain fatty acids for a quick moment, because these are stars to me as well. And I think this can go into another conversation for another day. But basically, these insoluble fibers create short-chain fatty acids in the gut. And short-chain fatty acids, I think, are our body's mechanism to heal itself. We use these to do gut healing. So if we're not creating short-chain fatty acids, which come from good bacteria and good fiber. So maybe that's why we're seeing these high fiber diets, right, produce this, and we see the benefit. In fact, I give short chain fatty acids, our favorite being butyrate, to clients for different reasons. So I'll be curious if in your research you study direct options, or if you'll just look at the microbiome, because you can create short chain fatty acids by fiber and good bacteria, or you could give it.
It's tricky
Yeah.
to get adequate butyrate to the colon. So I don't want to mess with what you're doing, but many of the models and clinical studies where they've tried to give enough butyrate is very small.
Mm-hmm.
It's one step or two carbons. It is a volatile acid.
Yes.
So that it's so small that it absorbs right through the stomach, through the intestine. So very little would make it to the colon.
Right.
So it is difficult to use butyrate in that fashion. And, it's broken down quickly because your body will break it down.
Right.
The reason that the fiber and the bacteria in the gut are able to work and make it at a high level is because there's no oxygen there. So when it breaks it down, it can't make it go from butyrate to acetate or to sugar.
Right.
So it's the Krebs cycle. So it's not able to do it, and that then gives these acids the ability to enter the colon cells, and the colon cells, go, great, this is food. So you were right about that. And as I was saying, in addition to feeding the colon, it also communicates with both the nervous system and the immune system. Is it the only way that fiber and the gut bacteria communicate? No. We know that there are other pathways. I just reviewed some work suggesting that the breakdown of an amino acid called tryptophan, which can be broken down to make serotonin, which is, how you have peristalsis in your gut and how you become antidepressed, normal. That's regulated by the gut.
Right.
That there are other chemicals that, as some of the other speakers talked about, that can affect heart disease, that can affect autism. So there's a large number of diseases other than immune diseases that can be affected that are both central nervous system as well as the immune system. And they're also metabolic disorders. That is, it is possible that you can have a gut bacteria that causes you to be fat. And that's not an excuse for people that say, well, I can't help it, my gut bacteria made me fat. But it's partly true.
Right.
And that's why it takes so long to lose weight, that you not only have to change your diet, but it can be 3 to 6 months to modify your gut bacteria so that they're not trying to make you eat sweets. As I mentioned in my talk, you have gut bacteria that can make you hunger for sweets.
Right, definitely. I see that every single day. And so when you start to manipulate that, which I think we can do quickly, you can severely decrease the cravings for sweets. So it's not necessarily people's fault that they're having this craving. It's happening within them. So we could talk more about butyrate, but let me mention also, I think people are going to want to know this, so I'm going to bring it up. This isn't the right fit for everyone, and it's a different conversation for a different day, but we find there's a lot of talk right now about the use of fasting for to help support some cancer, and that is supposed to increase butyrate or short chain fatty acids as well. What's your take on that?
All right. So if someone is physically able to undergo a fast and mentally able, then fasting for 1 to 3 days is a good thing for you. I have only fasted 1 day in my life, although when I started on a diet a year and a half ago, I pretty much made it a day. So, it takes, a strong willpower, but you will discover that most people eat out of habit rather than true hunger. And that usually hunger comes on over time, and then you often can easily fast a day without it really bothering you significantly. And one of the ways you will be able to tell when you actually start to get hungry is that you'll start smelling better. You'll be able to recognize smells in your environment. Oddly enough, most people eat so often that their olfactory system is shut down. And one of the early things to be able to tell when you actually get to a point where you have some hunger is that you can smell the smells in the room or outside much better. So when you fast for a few days, that tells the bacteria in your gut that the ones that can eat on the mucin layer in your colon are going to grow a little bit better.
Like
and
Ackermann's,
those are a lot correct. And there are others. And so those are bacteria that are like the ones that eat the high fiber. They're more likely to make the short-chain fatty acids, and they're more likely to have a good relationship with your body. But, all these things, nothing cures everything.
Right.
So you can't take someone with a terrible autoimmune disease or a terrible cancer, and they starve for 2 days or 3 days and say, hey, I expect to be cured. Nothing is ever as simple as that.
Right.
But if you ask general health benefits for someone who is overall healthy, yes, periodic fasting a little bit is probably a healthy thing.
Right.
If you ask if one should take inulin or prebiotics, my answer is yes, those should be good things. You have to adjust your body to it.
Yep.
If you ask should they take probiotics, then I'm going to be very cautious because for each person, different probiotics may be better for that person. Mm-hmm. And the study that was done, again, from Wargo's group, and they have reported this at meetings. Again, it's not been published, although Aaron Segal at the Weizmann Institute in Israel has shown it. If you have population, about 40% of people on cancer therapy are taking probiotics. On average, they do worse than those that are not taking probiotics. And the reason is not that probiotics can't help, but that, as I mentioned in my talk, and Aaron Segal and his paper show, many of the probiotics that are available are not the best probiotics for helping your immune system or for your particular biology or genetics, and they can actually prevent the right bacteria from growing in you.
Right.
So one has to be very careful as we recommend probiotics to have some basis in knowledge, and that's why I do admire some of the groups, both microbiome labs, Vedanta, and potentially even Merck, as they try to evaluate what is the best collection of bacteria to have in your gut to fight this disease or that disease.
Right. I'm going to go back one topic and just say, we were not recommending fasting for someone it's not appropriate for, and there's ways to make that more simple. I just want to put that clarification point there. And then second, absolutely, all probiotics are not created equal. I think you made an interesting point there, how the people without probiotics did better in that study. I mean, they're not created equal. The old school recommendation 10 years ago when I used to talk about this was the widest variety of strains and the highest CFUs or colony form, the most probiotics, per capsule. That's not really the case necessarily anymore, to be honest. If you're following the current that's just not the case anymore. And it'll take a while for everyone to catch up on that, but that's not necessarily what's the most beneficial.
Right. From this meeting that we had with NIH last week, the minimum number of strains to build a consortium in your gut that may help you may be at least 15 to 20 to 30, and maybe even more. Well, the problem with that, if you're trying to sell a probiotic, is that getting a reproducible consortia of 15 to 20 different bacteria is not easy. Mm-hmm. So it may be, and I'm very hopeful, that some of the spore probiotics, like Microbiome Labs and others have, may help shift the collection of bacteria in the gut in a favorable direction, but we haven't learned that yet. We're gathering the data, and I'm, as I say, tremendously admiring companies that could just sell a probiotic and not research it, but I admire the companies that are trying to get the best data so that you really can match the patient to the probiotic.
Right. What the thought process is that if we put certain kinds of probiotics, let's say spores in, we're hoping that they invite other nice friends in, right? So it's not that you have to give all of the different strains, it's that we invite these nice guys in. I have one more.
Or that they prevent the bad ones from coming.
Right, exactly. I have one more question that I think people were probably thinking earlier on, and a colleague of mine who was at the conference with us was wanting me to ask this to you. She was wondering do you think you can use immune checkpoint therapy in those with autoimmune conditions, or is that a future that you see?
So it turns out that was a question that a colleague of mine investigated at UT Southwestern in Dallas, David Gerber, and there's been some other reports from England that, yes, you can still give this immunotherapy to people that already have an autoimmune disease, but you do have to tell the patient that they are at increased risk. In other words, their autoimmune disease could get worse, but only occasionally, which is very interesting, because if you took my presentation at face value, you'd just say, all right, if I turn on the T cells and they're already attacking the person's, gut, then they're going to get worse diarrhea and colitis. But it turns out that that's not always the case, that 2 out of 3 times that antibody can go and help the T cells attack the tumor and not automatically worsen the autoimmune disease. But it's a little bit higher rate of autoimmunity than someone that's never had it. Mm-hmm. So you do have to warn the patient before you give it. And interestingly, we may have ways of controlling that so that even though they have a background autoimmune disease, you can still give the immunotherapy. Mm-hmm. And that's at the research side, that you may be able to give an anti-inflammatory antibody at the same time that you give the immune checkpoint blocker. And that is work in progress. That is not standard of care, but it's one of the trials that when I get to a new university or a new institution that I would like to have available, so that patients that you described that have rheumatoid arthritis or have had Crohn's disease or ulcerative colitis may be able to get the immunotherapy and reduce their risk of side effects. Mm-hmm.
Well, Dr. Frankel, thank you so much for coming on and sharing all of this with us. I think we could continue talking for a long time about people. I mean, to have someone who's on the inside of cancer care and someone who's really progressive, I feel like there's an endless amount of questions we could ask with how prevalent this is becoming. I hope you'll consider coming back as we get listener questions to do some Q&A as you get settled in your new location. Until then, where could people find you online, if anywhere? Maybe they cannot yet. What's next for you? You're rehoming your grant to a new institution, yet to be determined.
Right.
Will you see patients, or what's next?
Yeah, so, it's probably going to take 3 to 6 months for me to, because I've got to interview, and these places have to decide whether they want me. So some may like me, some may also like this research, but, you have to find a place that they're interested, because as you point out, I believe it's cutting edge, but it's not what everyone wants to work on, or every university or every hospital. Mm-hmm. So I really am interviewing and looking for places that are interested in this interface between your diet, your gut bacteria, and immunotherapy and cancer as an important topic. And, that's my goal. So in the meantime, obviously I have an email, afrankel59@gmail.com. But I guess since I don't really know the breadth of your podcast, it's probably best that they contact you, and then, you can relay them to me. And I'm more than willing to help anyone, because obviously for the next 3 to 6 months until I'm fully relocated, I've got free time to help your patients and help any of your colleagues. I really believe you and the practitioners like you that are trying to help people in this sort of new field have my highest admiration.
You are so kind and so generous and so sweet. So if anyone has a question for Dr. Frankel, we'd love to have you send in a recording. You can either open the voice memo on your phone and record a question and send it to hello@lessstresslife.com, or go to the website lessstressedlife.com, and there is a SpeakPipe widget on the side where you can click on and record a question, and we'd love to have Dr. Frankel answer those for you. So we hope that he'll come back, and I know this episode will be very well received, and I hope that you share it with someone that you love. We'll talk soon.
Thank you.
One of the best gifts you could give us at the Less Stress Life is your feedback. We are paid in podcast reviews. If you enjoyed this or any other episode, please leave us a review. In the iTunes store or from your podcast app, just search for Less Stress Life as if you're not already subscribed. Click on the banana face image, scroll to the bottom where it shows the text of other reviews, and write a review. While you're there, hey, make sure you hit subscribe. For Android or Stitcher users, you gotta go to the desktop site and search for Less Stress Life, and then scroll down to leave a review. Stitcher doesn't load Apple reviews on their site, so if you want, you can leave a review in both places. Your feedback means a lot to the success of the show. Thanks so much for taking the time to do that. You rock.